Thank you all for coming. I'd like to welcome you. I'm Catherine Magnuson. I'm the director of the Institute for Research on Poverty. And on behalf of IRP, the Department of Economics, and the Lampman family, I want to thank you for joining us for the 21st annual Robert J. Lampman Memorial Lecture. We are thrilled to be able to finally do this. So we had this lecture, and Hilary selected as our featured speaker, planned for April of 2020. And then we had it planned for fall of 2020, and then spring of 2020. And so, as you can tell, we've been waiting a long time for this event. And we're very glad and fortunate to have the Lampman family here with us in person this afternoon and tonight. And they are particularly happy that we have Hilary here, and you'll hear about why that is. As always, we're incredibly grateful for their ongoing support, not only of this lecture series, but also of IRP and the University of Wisconsin in general. Now, before introducing Hilary, I want to say a few words about Robert Lampman. Bob was a professor of economics at UW-Madison for over 30 years and the founder and guiding spirit of the Institute for Research on Poverty. His research spanned many topics related to social welfare policies and programs, and he was by all accounts an exceptional and unique scholar, teacher, mentor, and individual. And I know many of the former IRP directors who are with us today feel like we stand on his giant shoulders because he has built the institution to be an incredible, incredible resource for the state of Wisconsin and the nation as a whole. When Bob was evaluating public policies or considering potential policies, he came to be known for asking a simple question: what does it do for the poor? In 1964, Bob authored the poverty chapter of President Johnson's economic report. The chapter served as the nation's blueprint for the administration's anti-poverty efforts and established Bob as the intellectual architect of the war on poverty. I'll say that again. The intellectual architect of the U.S. war on poverty. I think we can all recognize what an incredible contribution that is. During his time in the Johnson administration, Bob also worked with federal officials to establish a national research center dedicated to the study of the nature, causes, consequences, and cures of poverty and social inequality. IRP is now 57 years strong and continues this commitment to Bob's vision to create a better anti-poverty policy and economic mobility policy that is informed by rigorous research. After Bob's death in 1997, IRP, with generous support from the Lampman family, established the Lampman Lecture Series to feature eminent poverty and social policy scholars whose work addresses the topics to which Bob devoted his career. And today's speaker, Hilary Hoynes, is among the very top scholars in the world that focus on questions related to anti-poverty policy. I'm sure most of you, if not all of you, are very familiar with her path-breaking work. Hilary is a professor of public policy and economics and holds the Haas Distinguished Chair in Economic Disparities at the University of California, Berkeley, where she also co-directs the Berkeley Opportunity Lab. She is a member of the American Academy of Arts and Sciences and the National Academy of Social Insurance, and a fellow at the Society for Labor and Economics. I apologize. She does many things, and I actually have to read them all. I can't commit them to memory. She has served at the National Academy of Sciences Committee on building an agenda to reduce the number of children in poverty by half in 10 years. And in 2014, she also received the Carolyn Bell Shaw Award from the Committee on the Status of the Economics Profession of the American Economic Association. As you can tell, she is revered not only by her profession, but by those who think seriously in the DC area and outside of DC about how to improve the lives of children, particularly those that are low income. Her research has contributed an impressive range of topics, including poverty, inequality, and the safety net. She's published widely on welfare reform, the Earned Income Tax Credit, and SNAP, as we like to call it, food assistance. And the outcomes that she has looked at includes labor supply, employment, marriage, divorce, infant health, and education. And I think what's incredibly important to us here at IRP, I'm sure to Bob Lampman as well, is that her work, or a major theme of her work, has been the importance of framing anti-poverty programs as long-run investments in children's well-being. Now, for all of those reasons, we would be thrilled to have Hilary here. But it is especially thrilling to have Hilary here because we like to claim her as one of our own. And that is not just because she's an affiliate, and we love all our affiliates and claim them all, but also because her father was here as an economics professor for many, many years, and her mother worked at IRP, as I understand it, as a computer programmer. So we still have where our computer programmers here today. They live on in her legacy. We have some in the back. And we're just thrilled that we have you here to give us this lecture, and we can't wait to hear it. After the lecture, we're going to have some time, sorry about that, we're going to have some time for questions from the audience, and then, as you can see behind, we have a reception set up. So we're thrilled to have you here and can't wait to hear your talk. Thank you.
Wow. Thank you very much. I have to confess from the onset, first of all, I'm delighted to be here. I was supposed to be here in 2020. And to see you all here today, taking time out to come to campus lectures again is really great. And I do feel like I'm a child of this place. I remember going in the computer room, and my mom would work there on Saturdays, and it was really cold and really loud. That's what I really remember. And she let me write a letter on on the computer cards. What were they called? Whatever they were called, the punch cards. So I do have a lot of memories of this place or that place over there. And I want to thank John and Jim for being here today. I'm looking forward to talking tonight. In a conversation with my dad a few weeks ago, when we were talking about the lecture, he talked about what Robert was like as a senior colleague when he first got here as a young assistant professor. So my sisters are here. It's a little daunting, to be honest. I'm not going to lie. So they're in the back. That helps. Thank you very much for sitting back there. But I'm just delighted to talk to you today about children and the social safety net. And one of the things that I've been musing about a little bit recently is the question of why economists focus so much on the costs of programs and don't focus on the benefits of programs. And so if you'll permit me a combination of, I hope, rigorous science and navel gazing, that is kind of what today's lecture is. So let me start by just sort of setting the stage. So this is just data from the OECD. It's a scatter plot of countries. On the horizontal axis is, as a share of GDP, how much does the country spend on benefits for children, family, child benefits? It's kind of a narrow definition, it's cash, but that's what it is. And on the vertical axis is a measure of child poverty that is harmonized to be measured similarly across countries. And what you can see is a couple of things from this data. One is that they're downward sloping, the pattern, which is to say countries that spend more on children have lower poverty rates. Not shocking. Perhaps that's exactly what we would all expect. Spending more leads to lower rates of poverty. But also notable on this graph is just where the US sits among our competitors. So we're obviously a very large and very rich country, but we don't spend a lot on children, and we have a very high poverty rate. So that's the first fact. The second fact is we do not, as a comparison to other countries, underspend on all groups. So this is a graph that shows a similar figure for the elderly. This is just showing the spending, not the poverty. And you can see that the United States is a little below the average for the OECD, but we're much more in the middle of the pack in comparing the share of our GDP that we spend on the old. It's really our spending on the young that we diverge from our peers, our competitors. And so the question that myself and my colleagues Anna Iser and Adriana Yarosmuni mused about was why? Like, what explains that? And, you know, I would be here for another 2 years if I really got into all the many reasons why I think that's true. And I want to focus on one of them today. And that is what we miss when we as a discipline, and I'm speaking, I know we've got an interdisciplinary audience here, I'm speaking as an economist in this moment, is what we lose when we focus on measuring the disincentive effects of programs, like when you implement a child tax credit, how does it affect labor supply? That's a big debate right now about the 2021 child tax credit. If we spend a lot of time doing that, to the absence of, or the neglect of, analyzing how these policies affect children in the short or the long run and their families. And so we've been thinking a lot about what is missed there. And so I want to sort of talk about a couple of things in this talk. One is how I think we got to this point of spending more time talking about the benefits, and to give you a quantification of just how far off we can be in thinking about the efficacy of programs if we only measure costs and don't measure benefits. I know it's a kind of obvious point, but I want to give some kind of teeth to that in the context of reviewing some work that I've been doing on the long-run effects of the SNAP program, food assistance. But I want to start by just kind of giving a little bit of quantification of this point about what economists have spent time studying. So what we did is we went back all the way to 1970, so in the early days of the IRP, to the present, and we went to the following set of journals, academic journals, that I have listed on the slide there. The top 5 general interest journals in economics, and then many of the top field journals where a lot of work on the social safety net would occur. And we did this all the way back to 1970, and we identified every paper that was published in that almost 60-year period on policies and programs that target low-income families with children. So AFDC, TANF, the Earned Income Tax Credit, food stamps, Medicaid, negative income tax experiments, et cetera. And then we categorized them as to whether they were studying the benefits of the program or studying some costs, like disincentive effects on labor supply or marriage or fertility. And so here is the data through the year 2000. And the red line, the higher line, is the papers that studied the disincentive or incentive effects, and the blue line is measuring the benefits. And what you can see over this time period, which anybody who works in this field would have concluded by their own knowledge, is that we spent a lot more time measuring costs than we have measuring benefits. So over this period through 2000, only about a quarter of these academic articles focused on measuring the benefits of these programs. And so, what do we make of that? Like, why is that important? Well, at some level, if we're thinking about whether or not we should do more of a program or less of a program, it doesn't really make sense to only focus on the costs. And disincentive effects build into the costs of programs. So if we want to do some redistribution, and as part of that, we end up with fewer people working, that's important to quantify. That's part of the cost of doing that redistribution. And that's not unimportant. I've written many papers that study the effects of labor supply. This is not a talk about we shouldn't analyze labor supply. But the point is, it's not very useful in itself. That is, if it takes some loss of employment to do the redistribution, that may or may not be helpful depending on what the benefits of the redistribution are. And it's a kind of simple point, but one that shockingly, as someone who spent their now 30-year career studying poverty, I only started thinking about like 3 years ago or 4 years ago. And I don't think I'm alone. So it's interesting that from this perspective that sort of makes sense, like these are policies targeted at improving children's outcomes, but we have not spent very much time analyzing how these programs affect children's outcomes. We spend most of our time talking about how they affect parents' decisions, but not about how these decisions and income that we're providing have downstream effects on the kids. So that's why it's important. But things have changed. So now if I extend this data series out to the last decade, it says 2010 there, but it goes through the last periods that we have quantified through. I think it's 2019, or I think. What you can see is that the picture has really changed. And we now have a situation where there's about 2.5 articles being published in the last decade or 15 years that study benefits relative to one that's analyzing costs. So something has changed, and the nature and composition of the work that's being done has really changed a lot. And so that's part of what I want to talk about today. So in terms of this kind of new growing focus and set of studies that analyze the benefits, essentially, a study looks at the effects of, say, the Earned Income Tax Credit or SNAP or other kinds of income or Medicaid, and analyzes the effects on health outcomes, criminal justice, long-run employment and education, human capital outcomes, essentially kind of asking the question, how does doing more spending today change the life trajectory of children? And so that's sort of the as Catherine said, that's kind of where I'm centrally interested in today, is asking questions sort of in that space. And what I'm going to try to do today is to go deep on one application that I've been working a lot on, which is the food stamp or SNAP program. What is it called in Wisconsin? In California, it's called CalFresh. Is there another name for SNAP in Wisconsin? Food share, okay, the food share program. And to sort of illustrate what we've learned about the long-run effects of these investments. And then I'm going to kind of zoom out and kind of wave my hands and tell you that what I showed you with food stamps, we're seeing replicated in context after context after context. And I think that it is credible to say today that we have the evidence that we should be thinking about the social safety net, the narrative of how we talk about it as scholars and others outside this room, is as an investment in children. And therefore, to some extent, those costs of the program are being paid back in the long run in a very narrow-minded fiscal lens. If a child grows up and has higher education, they're going to pay higher taxes in adulthood, and that's going to have a feedback effect on the government ledger. And so even folks who are skeptical about the inherent value of anti-poverty programs may be able to have some more ways of thinking about it if we admit that, just like infrastructure, investments in children pay off to some degree in the long run. So that's sort of what I want to talk about. So for those of you, I imagine not very many, given the audience and this esteemed IRP organization of 57 years, but let me just give you a few more facts. So, I started with this graph that looks very discouraging. And I was thinking, as Catherine was talking about the war on poverty and the view of many that we fought it and it's won and all that sort of thing, let me give you a little bit more before going into this research. So this graph here kind of focuses on looking at the time path of child poverty back to, we've been measuring poverty in the early 60s for children and for all individuals. And the reason why I want to show you this graph early on is to just recognize from the onset that we have had periods of time where child poverty rates have declined. So while that graph shows us as having very high poverty rates, I don't think it's a mystery about how we can lower poverty rates. And so there are two sort of main periods that explain the times where we've seen these declines in child poverty. And it's either because we're spending more through some expansion of a social safety net program, or we have very strong labor markets where we get rises in wages for low-skilled workers. So let's just dispense with that from the onset, that we do have evidence that we can lower child poverty, and I think we sort of know the elements of how to do so. This has gotten, maybe 6 months ago, many people, not in this room, but in a general context, would have been surprised by that graph. But there was a very high-profile study that came out of Child Trends recently and they paired up with Jason DeParle, a very famous anti-poverty writer for the New York Times, and it was a front-page story on the Times, basically talking about this history and showing the declines in child poverty. This is the same data that I've just showed you, but it's zeroing in on the 93 and on period where we start to see this real decline in the 90s, kind of decline, flat decline is sort of what the period looks like that the Child Trends article focused on and DeParle's piece. So I think there's a lot more recognition that child poverty is something that we can change. It's a policy decision, as they say. So I want to get that sort of point out there. I also want to just, in a very high-level way, 35,000 feet, how would I describe the social safety net in the United States to, say, someone from Europe? So what is your safety net like in the United States? I would say a couple of things. One, it's not universal. So in particular, the United States tends to focus the benefits that we do have on children, elderly, and disabled. So that's one fact that's been quite true for a very long time, mainly leaving out prime-age adults without children and undocumented individuals. Very little of the safety net for families and children is delivered in cash, quite in contrast to the safety net for the elderly. It tends to be tax credits and in-kind benefits. Increasingly, particularly starting with federal welfare reform, a very heavy use of conditionality, which typically translates to you have to work to be eligible for benefits. And that certainly occurred as part of the transformation of AFDC to TANF. Also, of course, is embedded in the tax credit programs that are currently on the books. And increasingly is also concerns about that extending to SNAP and Medicaid. And funding levels aren't that high, which we already looked at in the first graph. But what are those programs that provide benefits for families with children? Very quickly, this is just by dollars spent. And you can see that the tax credits are our biggest spender for families with children, followed by Medicaid, then followed by some cash assistance, and then SNAP, and on from there. It gives you some kind of perspective on that. But I think more relevant to this conversation is which are the programs that are doing the work to reduce child poverty. And so by that measure, the tax credits are the largest anti-poverty programs for children in the United States, the Earned Income Tax Credit and Child Tax Credit, even before 2021. And second is the Food Assistance Programs, or SNAP. So both of those kind of buckets of assistance reduce the child poverty rate by 5 or 6 percentage points each. So those are the really big action in our current policies. So with that sort of description, let me talk a little bit about our own sort of timeline of how it seems we went to not looking at benefits to looking at benefits. And this is the navel-gazing part, and then we'll switch back to the science part. So, Anna and Adriana and I spent a lot of time talking about our own, as three people who sort of made this own sort of journey from looking at disincentives to looking at benefits, why, how did that happen for us? So I got my PhD in 1992, and my job market paper was on how welfare affects labor supply, and that's what we did. So I think that there were a couple of elements that I think were very that seem to be common in our talking with people about how we got to thinking about looking at the long-run effects of the safety net. And one was the very early work by Janet Curry and John Gruber studying the expansions to Medicaid that started in the 80s, not the ACA, but the expansions to Medicaid that happened earlier, originally under George Bush Sr., administration. And their first two papers on this looked at the effects on babies. The paper was called Saving Babies. And the second paper was on how more access to Medicaid affected children's utilization of medical care. So it wasn't about labor supply. That wasn't the first paper that they wrote. And that was really notable, I remember, at the time. And then at the same time, although I didn't see these in my mind together at the time, again, Janet Curry, who I think just the bottom line is was very influential in this transition, and Nancy Cole wrote a paper that did sort of like the studies that we were doing at the time, we, the royal we, not me, we, on sibling fixed effects estimators for effects of Head Start. With the NLSY and those kinds of data. And they did a similar analysis of AFDC and the benefit levels and looked at the effects on birth weight among children. And so I think that was our first paper we could find that was like a very clearly in the category of current programs looking at the benefits. And so this is what I characterize as like the 1990s when we started to quantify short-run benefits. And then I think the next really critical element, as particular to thinking about the lens of the long run, was the absolute explosion of work on the fetal origins hypothesis, on all the many, many studies that showed that the in utero in early life environment for children is a particularly vulnerable period where when things go wrong, like nutrition famines, that's where the early work was done, of course, but then this expanded into looking at effects of pollution and many, many other kinds of outcomes. And consistently, there was a pattern that these exposures in early life, even if they were short, and this is true in developed countries and developing countries, that these impacts had like long-term scarring effects on the children that showed up not only in their domains of health, which was the original fetal origins hypothesis work, but also in the domains of economic well-being. And I think it was that where I and my colleagues recognized starting to put the, kind of line it up and say, well, wait a second, if these policies, if these shocks have these long-run effects, maybe things that are policy, manipulatable, that are more like resources, maybe resources have long-term effects on kids as well. And I think at the same time that this was going on, we also were getting the kind of new generation of work showing sort of the importance of the intergenerational transmission of income, so there was something there telling us about the importance of income on outcomes in the next generation. And then at the same time was this kind of second generation of work on these peri-preschool and other programs that showed the tremendous long-run effects that in some cases were even more important than the short-run effects that were tracked in the kids. So all of this sort of gets in the bucket of, wow, stuff really matters in the long run. And then I think in the 2010s, a lot of people, when I talk about this work, they say, oh, isn't it just data, Hilary? Isn't it just data that led to all this new work? I do not believe that that is true. Because, like the first paper I wrote on this used the PSID. It's been around for a while. My mom told me once that she was using, when they dumped the first 5 years of the PSID when it was first released, that she was very excited to be working on that at IRP. So obviously the very long panel has not been around a long time, but you don't necessarily, it's not a requirement to have administrative data to study this. It does make it much richer and more powered up and all the things, but it is not a necessary condition to do this work. So I don't think it's data, but I think data has really made this accelerate at a pace because we've got so many different sources of data that allow us to really dig into this. So that is my, attempt at trying to explain how we got from there to here. So what I'd like to do now is just spend a little bit of time trying to illustrate just how these investment impacts, what they look like. So I have been working with a lot of different co-authors for many years now on a series of papers that examine how the food stamp program affects outcomes in the short and in the long run. And for those of you who don't know what SNAP is, you're going to tell me again. It is called Food Share. Food Share. Okay, Food Share. So what is SNAP? It's an income condition program, so you have to have low income to be eligible. And as your income goes up, it's phased out. So it has a very kind of prototypical safety net sort of element to it. It's a voucher, technically, although today, of course, you get your benefits on an EBT card, and you can use it to buy essentially any food in the grocery store. And because everybody buys food and money is fungible, we think of it as being pretty close to cash. But it is not technically cash, and therefore not counted as cash income. And food stamp benefits amount to about $4 per person per day on average, so it kind of gives you a little rough estimate of how large it is. And it turns out that the food stamp program did not arrive across all of America at the same time. And there's a very interesting story that over some wine later on, I'd be happy to talk about what led to the basic fact, which is that it took 15 years from the very earliest counties in America that got food stamps to the last counties in America that got food stamps. And so essentially in this series of papers, we, like many other folks working on these war on poverty programs, because this is a very common thing in the war on poverty, a lot of the programs that were implemented were not implemented everywhere at one time. Head Start's another example. And so we kind of leverage this geographic variation in the rollout of food stamps across counties in the United States in a very kind of simple difference and difference kind of way in order to analyze the effects of the program. And what's sort of nice about this rollout, and is true in many geographic rollout studies, is that we can observe people today in the present in whatever data we have available. And if we know where people were born, what county, and when they were born, what month and year, we're going to have some characterization of how much of your childhood you had access to food stamps. And that is essentially what we do. Most of the data we analyze, we don't actually observe whether you're on food stamps. That we would need, we use that with the PSID, but not in these bigger data sets. But we do this in a sort of intent to treat way that we appropriately calibrate in order to basically ask the question, if you grew up in a county that got food stamps earlier in your childhood than someone who's very similar to you but grew up in another county, did your outcomes look different? And do your outcomes look different? And the answer is yes, they do. So the first paper we wrote, and you see this pretty consistently across a lot of different settings, oftentimes the first benefit paper you see is about infant outcomes. So that Curry and Cole paper that I mentioned on the AFDC program was looking at birth weight outcomes. And I think that's why that is probably a combination of this fetal origins hypothesis and this original focus on the importance of in utero. And also here's where the fact that we've had this vital statistics data available for so long, I think surely plays a role in some way. So in this analysis that we did where we used this variation across counties and over time, essentially what we were asking is, if a mom is pregnant and she has access to food stamps when she's pregnant, how different is the birth weight of the baby she ends up having? And what you see, and you see this in the context of the Earned Income Tax Credit, Medicaid, every analysis of resources that I've seen, and Medicaid obviously isn't resources, but healthcare, you see that when you provide more resources, when women are pregnant, they have healthier births. And so, and this typically shows up at more lower birth weight births. So lower risk of lower birth weight births. And so in our analysis, which I've just shown you the summary graph of here, we find that the results are larger for African American babies than for white babies in our analysis, which may be partially related to the fact that African American children would have lived in families who would have been more likely to participate in food stamps, given the differences in incomes on average between the groups. So then we went on, and in our next study, we actually used the panel study of income dynamics. And what was useful about using the PSID is that it is a longitudinal study that follows people from one generation to the next. And so we know something about family background for these children who we observe in adulthood. And in this study, and I'll walk you through what we're doing in this graph in just a second, we studied the effect of having access to food stamps in childhood on metabolic health outcomes. And so what is metabolic health? It's the kind of suite of obesity, high blood pressure, diabetes, heart disease. And the reason why we studied that is in this original fetal origins Barker hypothesis work in epidemiology, the studies on the rats that were done in this setting showed very clearly that it was metabolic health that you really saw worse in adulthood, whatever that means for a rat, but in humans, it seems to be like post-reproductive age. You have a higher risk of these metabolic syndromes if you have poor nutrition in early life. And so that's why we decided to look at metabolic health for our first analysis of this. And starting in the very most recent years of the PSID, they expanded to measuring health outcomes so we could construct this admittedly self-reported health measure. So what did we do? So we were particularly interested in the lens of how old you were when food stamps was introduced in your county. Because this work on the fetal origins hypothesis was very focused on, in particular, the importance of the in utero period. But we didn't know as much about the importance of these shocks post-birth in early childhood. And so we wanted to analyze the data within the lens of how old were you when food stamps was implemented in your county of birth. And so what I'm going to walk you through here is just a simple kind of event study graph summary of our main results in that paper. And so what the horizontal axis is how old were you when food stamps was implemented in your county? And as in any event study graph, there has to be an omitted group. And so and that's just a normalization. That's not a deep point. It's just a normalization. And we normalized age 10 to 11 as our omitted group, because from our reading of the literature, we were less sure that this nutritional intervention should make as much difference if it begins in later childhood than early childhood. So that's why we chose that. And you can see that the ages are bucketed into two age bins because the PSID isn't that big, so we needed to sort of make the data a little bit coarser here. And so this is estimated in a regression setting with a bunch of things in there. We don't have to talk about that because this is a general talk, so we can talk about that over dinner if you want. But it's a model, and these are the main takeaways of that model. So as we move from the right side of the graph towards the left side of the graph, we're moving in time of someone having, it's very cool to see the boats out there. My sister Megan rode here at Wisconsin. It's very awesome. It's very cool to see them out here. Sorry, it's a little distracting. It's very, very nice. So as we move to the left, you're kind of, the data is telling you what difference in this later life outcome, what is the vertical axis, is this index of metabolic health. Apologies, it's an index. It's in standard deviation terms, a little bit hard to interpret, but metabolic health is bad. So it going down is good. So let's start with that. So what does this graph show? Well, from ages middle to 12 plus down to about age 5, the dots are kind of flat. So that means if I'm 12 when food stamps is implemented in my county of birth versus 4, my outcomes are pretty much the same. I didn't have a strong prior on this, but that's what the data says. But then somewhere around this preschool age, you see this line start to go down. And so what that is telling us is that as you get access to food stamps at age 2 versus age 4, your risk of metabolic health in adulthood then 50 years later is improved, is lower. And it's weirdly linear, kind of like a dose response, like just more food stamps in that in utero to age 4 area, kind of more of that improves your outcomes in a just sort of constant linear way. I don't know why, but that's what the data shows. And then over here, it flattens out again. So what's happening over here on the far left? Well, this is sort of like what we usually put as like pre-trend or placebo tests in our event studies. So the idea is if food stamps is implemented 5 years before I'm born or 3 years before I'm born, should it make any difference? I was treated my whole childhood. So unless it took a really long time to ramp up the program, which it didn't, interestingly, we can see that in other data, we wouldn't expect the outcomes of kids to differ once you get sort of beyond full treatment. And so this is kind of helpful because it allows us to rule out that maybe there's just something different in these counties and there's just some weird trend going on that I don't know how to describe what it is. And so it kind of gives us more faith in the results. So the bottom line from this, now that I've walked you through it, is that more food stamps in early life leads to a reduction in metabolic health in adulthood. And these, these impacts are pretty big. This is like a 0.4 standard deviation improvement, which is large. And these folks are still pretty young. The older folks in our, just by when the war on poverty happened and when the food stamp program was rolled out. So, in another 10 years, if I'm still doing this work, these folks are all going to be Medicare age and we're going to have much better data and we're going to learn a lot more. And it could change. It could be that this just meant that we're all going to have mad metabolic health and these folks just had it earlier. I don't know. But it's a pretty interesting finding, I think. So now that I went through all the effort of showing you that graph, I'm going to show you more that look exactly the same methodologically, and I don't need to walk you through it again. So in our most recent paper, we used data through the census RDC that takes the 2000 census, the 1 in 5 sample that has the usual kinds of things we analyze in the census. Are you working? What's your earnings? Are you poor? Where do you live? What's your education? Et cetera, et cetera. And we have that matched to what's called the Numident file, which is SSA, Social Security Administration's little block identifier that tells you from birth certificate data where you were born and when you were born. And so from that, we can basically take the census, the 1 in 5 census, and combine that with this information about where you were born and when you were born to do kind of analyses like this, but for a much broader range of outcomes, and also with much bigger samples. And so what we find is something very consistent to what I just showed you there. And I'm going to show you a few graphs from that work. So this is, the same construction of the event study. Now we have data for every year of age because we've got a much bigger sample. And this is looking at the effects on human capital, completed education, and various other measures. It's really completed education. And we have the same, omitted year as age 10, so everything is relative to age 10, and you find a kind of similar story. Having more access to food stamps in later childhood on the margin doesn't seem to have much impact on your later life outcomes, but once you hit the preschool years and earlier, you find that more access to food stamp leads to improvement in your human capital outcomes. And this is also an index in standard deviation units. I'm so sorry, but I will give you some actual numbers in a couple slides. But from this, what I want you to take away is this pattern of more access to food stamps, particularly in early life, seems to be important. And it is important across a wide range of domains. So more education. We know precisely where people live because they geocoded it if you access it in the RDC. And so we constructed something that we call a living quality index that includes things like, are you a homeowner? What is the poverty rate of the census tract that you live in? Do you live in a single family home? What is Chetty's measure of upward mobility for this county? Just a big hodgepodge of things about where you live. And you see a very consistent finding of a very different kind of outcome of living in better locations when you have access to food stamps. So to give some numbers, some takeaways, is if you have food stamps from conception, or what we measure as that, to age 5, compared to not having that, you have a 11% reduction in mortality. Now, these folks aren't very old, so the mortality rates, or the baseline rates, are pretty low. but an 11% reduction in mortality, a 0.5 percentage point increase in the probability of not being incarcerated as proxied by the group quarters variable in the census, a 6% increase in some college attendance, a 7% increase in earnings, and so on. So a pretty broad range of outcomes. Are those big? Are they small? I don't know. I'll show you a takeaway measure of that. But it's pretty systematically positive. And in a way that we feel, it seems pretty convincing that it's this and not something else. That's the point of doing the kind of event study version. So that's sort of, I think, what we've learned in some ways about just this one program, just to kind of put some teeth on what I mean about the long-run benefits. But there's so much work going on. There's work going on different programs. I've listed some on the left. There's some really interesting work that Randy Aki is doing. He uses data from many, many Native American communities, have used their profits from casinos and turn them into basically guaranteed income programs, like way before people were talking about guaranteed income programs. And he and his co-authors have collected all this data and are relating that as a resource measure to looking at long-run outcomes. So it's not just in the social safety net, it's like anywhere where we have some purchase on some expansion of resources, and you tend to see pretty consistent findings of improvement in outcomes in the short run and improvement in outcomes in the long run. So what do we make of this? What does this add up to? Well, there's a very nice paper by Nathan Hendren and Ben Sprung-Kieser that took 200 and something different interventions and quantified the benefits relative to the costs in a kind of similar method that they didn't invent it, but they sort of more than popularized it. They gave it some rigor and popularized or consistency. And this marginal value of public funds is really just the ratio of benefits divided by costs. And so the numerator are the quantifications of things that families would value, like my earnings are higher, I have a longer life, and these sorts of things. And the denominator is government costs, but they're net government costs. So it's not just how much did we spend on this program initially, but what are the disincentive effects of labor supply that made that program more costly when we delivered it? That adds to costs. But then what minuses to costs is the fact that when kids are older and their earnings are higher, they pay taxes, and that comes back in a PDV sense, present discounted value. And so all of the costs are in the denominator, and that's, in principle, that could be zero if all of those, basically with Medicaid it is. So the benefits to Medicaid are so strong that it basically pays for itself just on the government ledger. That SNAP doesn't quite get there, but that's this measure, the marginal value of public funds. And if we take all of those studies that I just talked about, we get a marginal value of public funds of 62. So $62 worth of benefits to the families that received the program relative to $1 for the government net cost of the program. So that feels pretty good. And if we were to have calculated this marginal value of public funds and not done all that analysis of the kids, we would have gotten a number of 0.69. So, basically, it costs money to do redistribution. And so you get less than $1 of benefits for $1 of costs because of Okun's leaky bucket of labor supply. But if we don't calculate the benefits, then we're just left with this 0.69 where you say, well, this doesn't seem like a very good program. I only get 69 cents for every dollar you spend on it. But it just seems so obvious from where we sit today that for a long time we weren't quantifying things in the numerator and we were only counting things in the denominator, and that doesn't seem very smart. So this is just a really cool graph from their paper. I'm not going to talk about it, but it's just an advertisement for, one of the findings they have in the paper is that programs, and these are not just safety net programs, education, all sorts of stuff, human capital, active labor market policy, but pretty consistently, the programs that are targeted at younger people generate higher benefits. So the horizontal axis is how old were the people getting this program, and the vertical axis is what is that marginal value of public funds. So first of all, like 62 looks pretty big. Like this scale goes from, 1 to 5, and then there's infinity. Those are the programs that fully pay for themselves. That's why it's infinity. So, 62 is pretty big. Okay, so I want to end with, like, what does this all mean for current discussions about reducing child poverty? And, the obvious thing to talk about is the 2021 child tax credit. So, within the context of that very first graph that I showed, it is amazing, and I still think it is amazing that we had this expanded child tax credit for 1 year. So I want to talk about that a little bit. Child allowances are very common across other developed countries. They tend to be very universal. Everybody gets it if you have a kid. It's not meant to cover your basic needs. It's $3,000, $4,000 a year per child, varies from place to place and so on. So we have a child tax credit in the United States, and we have had it since 1997. It was originally introduced in the Clinton administration, and it was most recently expanded in a permanent way in 2017 under the tax bill passed by Congress under President Trump. And the interesting thing about our existing child tax credit is you can have very high income and be eligible for the child tax credit. So the current law in 2022, as was the case in 2020, is households would get a tax credit of $2,000. And this particular chart shows this for single parents. It's double the size for married couples in terms of the income phase out. And so you can earn $200,000 a year as a single parent and get the full $2,000 of the child tax credit. So most people get it. In fact, only 2% of children live in families whose income are too high for them to be eligible for the child tax credit. Yet, 35% of children live in families whose incomes are too low to gain the full value of the child tax credit because, like the Earned Income Tax Credit, this policy requires you to have earnings, but not just some earnings. There's an actual income limit that admittedly has gotten lower over time that basically amounts to, if you're a full-time worker earning the minimum wage, you can barely get to that maximum $2,000. The federal minimum wage, not the minimum wage in California, $15 an hour. And so we have something that we've had for some time, and it does do some anti-poverty effectiveness, but it was not designed for anti-poverty relief because otherwise you wouldn't leave out 35% of the poorest children in America. So it's a little bit hard to explain from first principles why you would have a policy designed this way if the goal of it was to try to help families cover the costs of children. So the 2021 American Rescue Plan included an expansion of this child tax credit. And it did two things, both very important. The first one was it expanded the maximum child tax credit you could get up to $3,600 if their child was less than 6. Sidebar, I think the work, not just ours, but other work, led to precisely why less than 6. Like there's just more and more evidence that early life is a particularly vulnerable period. And also, as we all know, a very expensive period with respect to childcare and so on. But the second thing was that the payments were allowed even if you had $0. So not only was there not an income requirement that started at, like the Earned Income Tax Credit, as your earnings go up, your credit goes up, but you were eligible for the program even if you had no earnings. You still had to file taxes, and that's a big hurdle, and we're still learning just how big a hurdle that was. But in principle, this is pretty close to a universal basic income for children because of how high in the income distribution it went. So this $3,600 or $3,000 got phased out in the $120,000 range. So that's very high in the income distribution in the United States. And so the question is, what do we make of this? What do we know? And what does it say about what I've been talking about in terms of the investment in children? Well, I think the first thing is that if this policy were permanent, it would be the biggest thing we ever did for child poverty in history. And I think would be sort of similar to what Social Security did for elder poverty. So way back in the day, in 1930, the group with the highest poverty rates in America were older individuals because we didn't have a safety net and couldn't work. Well, that's really changed. And now it's children that have the highest poverty rates in the United States. So it would be a very big thing to do. My estimate of what it would do to this graph, and this is literally like me doing this in PowerPoint, so nobody take a picture and tweet it or anything, but and the Columbia, maybe some people saw, their study just came out yesterday that estimates a little bit more of a poverty reduction than mine, so I'm going to work out those details. But the point is, it doesn't move us to the middle of the pack, but it does make a change in our poverty rate. And I also, built in the $100 billion it costs a year for it. So it also shows you just where it puts us in the spending category as well, relative to other countries. So interestingly, and I'm sure many people in this room know that this was a one-year policy and ultimately was debated as part of Biden's Build Back Better plan, which didn't happen. And interestingly, at the end of the day, although Catherine and I were having an interesting conversation about this on our beautiful walk over here, is that at the end of the day, at least in the public square, it was back to the work disincentive effects as to why this policy was not successful. On the record anyways, Manchin, who was the deciding vote, said we can't have this policy that's going to cause people to work less. So on the one hand, it's pretty depressing that here I am, I'm showing you oh, we're really doing this great work, and at the end of the day, it was the same old argument, I think, that I don't know, it's obviously a very simplistic view of it, but there was a way more attention to the work disincentives of the program than anything else in when it was being really debated. But what I would say, and some enterprising person out there should scrape all the congressional record and do a textual analysis of what people were saying on the House floor. I don't know, but I will say that in the press accounts of the debate, there was discussion about the work disincentives, but there was a lot more space in the articles that were talking about the benefits of the program. And in general, the long-term costs of growing up in poverty. And I'm not sure that would have been the case if we were having this debate 15 years ago, when I don't think this kind of work was out there. Or at least that's what I think. So very quickly, and I'll wrap up, what do we know? So we know that poverty went down when these checks started to drop, and poverty went up when they went away in pretty dramatic ways. We know that food insecurity declined significantly when the checks dropped, and they declined specifically in families with children and not in families overall, which kind of helps to try to make the argument that this was that and not something else. There's some evidence, there's many papers that have been written on the effects on employment and labor supply. There's a couple of papers that show zero effect, one paper that shows small negative effects. I just saw a paper the other day that looked at child welfare outcomes as measured by emergency department visits around the timing of the checks being dropped on the 15th of the month, showing quite dramatic declines. I think we're going to learn a lot more in the coming months and years about what this policy did. But what we know from the most recent data that was released by Census in September, as it does every year, is that the measured child poverty rate in the United States for 2021, that year that we had the tax credit expansion, was the lowest on recorded record for child poverty in the United States. And this graph on the left shows you how much the child poverty went down with this policy, and then a simulation of what it would have been if the policy hadn't been expanded. And that got a lot of press. So I do think there's kind of a lot of attention to what's going on. And that's good. So here's one table. This is like my last slide. I'm not going to go over all these numbers, but there's a really nice piece that the Columbia Center on Social Policy put out that took all the estimates in the literature for how these programs affect things in the long run and made an estimate of what that means if the child tax credit expansion was permanent. And what this takeaway is that they find that for $16 billion in net government costs per year, it would lead to $810 billion in benefits. So a ratio that's not that different from what we found for the food stamp program. So I think that's what's at stake, what's possible. So I look forward to your questions. It's just a delight to be here. I will leave you, students in the room, with a little bit of a wish list for what I think we need to know. I'm not going to talk about it, but I'll leave it in the background why we continue the conversation. So thank you very much.